Good morning. How are you? Welcome to Nigeria. Anybody first time to Nigeria? Oh, many people. Cool. First time to this event, Global Health Supply Chain. Oh, that's quite a few people. Welcome. Welcome. Okay, let's get going. My name is Ravi Anupindi. I'm a faculty at the University of Michigan in the Ross School of Business. And I chair the program committee for this Global Health Supply Chain Summit, right? I want to just take some time to walk you through who we are. This is like an existential question, right? Who are we? And this question keeps getting asked. Who are you guys? Why do you do this stuff year on, year off, every year, right? So I'm going to walk you through a little bit about the history and who we are, what are we trying to do here, and quick walkthrough about what the program structure is, and then we will move on to our keynote and plenary speakers today, right? Okay, I have to do two things. I have to flip the slide here. Is this going? Yeah. So I don't know if you can see it. I know the corner people can see. I don't know if you can see. It's kind of a little bit difficult because the chairs are blocking it. So if you guys can remove the chairs, maybe that will help. But what I have here basically is, it just forced us to think through about what is it that we are trying to do here. So this summit uniquely focuses on global health supply chains, right? Again, we are not saying global public health supply chains, we are saying global health supply chains, covering all components, including human resources and contextual factors affecting their performance. The event stands out by presenting a structured, holistic, and multi-stakeholder approach to addressing the challenges and designing and managing end-to-end global health supply chain challenges in LMICs. That's, as program committee, that's what we are trying to focus in on, right? It also serves as a forum to bring rigor and systematic thinking to the work of the field of practitioners. So this is a dominantly practitioner-oriented conference. As you may ask, what is an academic doing in a practitioner conference? Well, remember, I'm at business school. So we have to work with practitioners, right? We provide a platform to connect practitioners to latest thinking in academia as well as industry insights. The issues addressed range from technical and operational to governance, architecture, and leadership, ensuring relevance across all levels of supply chain management. I know it's a lot of words there, but this is how, over the years, we have begun to articulate who we are and what we are trying to do as a group here, right? Of course, welcome any thoughts. For those of you who have been attending, I know there are people here who have attended. Okay, let me show of hands. Who's attended every single summit? Yeah, there are a few people who have attended every single summit. I haven't. I missed one, right? Ian, I thought you attended every one of them. Missed two. Okay. Maybe we should have an award for people who are continuous attendance, right? Okay. So what is typically the structure of the event? I mean, I know you have the program itself. The way we think about this is, as a program committee, and I'll walk you through the program committee, is I say there is a curated segment of the program. The curated segment is inviting plenary speakers, leaders in the field, whether from government, private sector, international or multilateral agencies, and we bring that content through plenary talks as well as plenary panel sessions. So that's one part of the structure where the program committee works hard over 6 months to bring that content to you. The other piece is contributed in terms of whatever work is happening on the ground, we need to feature that. So we do a call for submissions. This year we received 152 submissions. We can't feature it all. We feature about, say, 45 talks and 20 posters, so there is a filtration process, and clustered them. So that is delivered to you in terms of talks, panels across 20 parallel tracks, poster sessions, side events. We don't, as program committee, we don't know everything. There are a lot of people who are working on the ground. You have some creative ideas you come up with and you host those side events. And then finally, tutorials and workshops, because it's also partly a little bit of educational to bring you up to speed about latest thinking in some area. So those are the things we do. The third element we've started for many years now is a price competition, just to showcase excellence in supply chain implementation in LMIC, right? So we have a price competition, we solicit proposals from submissions from people, we filter them, and shortlist the final 4 that get presented here. We have recruited a panel of judges, and we'll announce the winners on the 3rd day here. And finally, this is something we added as site visits. This was a demand or request from attendees saying, we go to a country, why can't we do site visits? So this started last year in Nairobi, and what you can do in half a day in Nairobi, you need 1 day in Lagos. So, right, so we have to set aside the whole day and did the pre-visit. I know some of you participated in that site visit yesterday. Obviously, we can't open that up to everybody. That's not our constraint. That's the constraint of the facilities. They said they can only host 20 people or 30 people, so that's how we do this. So later this afternoon, we will have a session to debrief. For those of you who did go, please come and share your experiences so others can learn from what you have seen. So broadly, this is the structure of the event that we curate. In addition, we had started a few years ago a small grant research competition and mentorship, right? So how to bring more rigorous thinking in solving supply chain problems. It started off as a pilot where my predecessor, Yehuda Basok, used his own personal money to fund a project in Indonesia. And then, really appreciate Chemonics stepping forward, and we developed a partnership with Chemonics to say, we will continue this initiative. So from 2011, we've been working with Chemonics for 3 years. So we open a call for research proposals. We then, shortlist, review, filter. We give 1 grant through in partnership with Chemonics. And over 9 months, we are mentoring them. We have once a month meeting, and just the work is theirs, and we basically are, understanding how they're approaching the problem to guide them a little bit. 2024, for this year, ARC, so Africa Resource Center, from Senegal, the continent-wide initiative, they stepped up saying we also want to partner. So this year, hopefully by the end of the year, the review process is still ongoing. We will be able to do 2 such research awards because now Chemonics and ARC has joined. So what have we showcased so far? Just to give you let me see this one. Okay, yeah. So in 2021, we had 36 applications, and we gave the small grant to the Ghana Health Service. And this is a complex problem. How do you manage the supply chain, both supply and demand, when there is a drug combination transition in HIV? So WHO comes up with a new combination therapy, and then you get into shortage situation. How do you carefully manage supply and demand? So that was the project. This is coming from Ghana Health Service, right? This is not, so, and then the way we do this stuff is typically the project starts sometime in January, and they come to this event and present. This is a 9-month engagement, and they present here. In 2022, we had 45 applications. We gave, we selected the Kenya Health Service. This was a proposal from Kusumu and Vihiga counties on data for decision making. How do we kind of think about use of data, quality of data, and all that stuff. So that was 2022. And then 2023, it exploded. We had 120 applications, but we have only 1 grant to give. It was hard to select, but ultimately we gave the grant, and we've been working with a group from Muhimbili University of Health and Applied Sciences, who's also partnered with the Tanzania Medical Stores Department. And they've just finished their work, and they're going to present in this conference in track 18, that will be on Friday morning. And their focus is on pharmaceutical waste. So as we are thinking about a lot more drugs and vaccines moving into the system, we need to have a way of thinking about how to manage waste. So really done fantastic work over the 9 months. So therefore, that is systems thinking approach to addressing pharmaceutical waste. I know it's a shortened title, you have a longer title, but please do take some time to attend their presentation in track 18 on day 3. The whole track is focused on pharmaceutical waste. 2024, we have 72 applications. Reviews in progress, hopefully by the end of the year. we should be able to select 2, and this will be jointly with ARC and Chemonics going forward. So this is something we're doing which is featured in the conference, but it happens throughout the year in some ways. And the idea is this is not our work, this is the work of people who actually do, but trying to basically work with them to, see how to progress and bring a little bit more rigor into the work that they're doing, and in whatever way we can assist, because this is where Chemonics comes in or ARC comes in, because they have a network. So if they have a network, and that can be leveraged to push that work further, right? So that's what we've been doing for a few years now, right? Now, a little bit on the history of this stuff. This is the 17th year we are meeting, and this is without any gap. So I think that's, I don't take credit for that. Yeah. I don't take any credit for that. Many of you, probably all of you, know at least one person, Prashant Yadav, right? So Prashant started this in 2008 in Zaragoza, Spain. It was a workshop to bring together multilateral agencies, donors, policymakers to begin to think about what are some challenges in global health supply chains. It was a workshop, maybe 50, 60 people. I remember Paul Lalwani and we all attended that workshop. He ran it for 3 years in Zaragoza, Spain. And then another friend of ours, Yehuda Basok, who was at University of Southern California, he took it and said, I want to continue this, and moved it to University of Southern California in LA. And that's when we were discussing that this should become more of a conference rather than just a workshop. I don't recall exactly, but that was 2011, but about 100 people attended. It became a 2-day event. And then we basically said, this is ridiculous. Why are we meeting in the Western Hemisphere when all of the problems we are talking about is LMIC, and mostly Africa-centric? So I have to credit my friend Yehuda to make the bold move, saying we will go to Africa. And 2012, he chose Rwanda and hosted it in Kigali. We have no institutional partnership with anybody else at that time. By ourselves, a bunch of crazy people saying we can do this and we can pull this off, which means go find a hotel, find all the partners who can actually help us, whether it is AV or this and that, food, everything, right? All the logistics that is needed to run a conference, the program, everything. It's about a 6 to 7 month process that we go through to put up this event. So since 2012, it has been in the continent of Africa, and you can see where all we have been in East Africa, in South Africa, and West Africa, with a few exceptions. 2014, Ebola crisis was, flashing up. We were thinking about going to West Africa that year in Ghana, but we were not sure how far Ebola will spread and what the countries might do to shut borders. UNICEF used to be on our program committee then, said, don't cancel it, come to Copenhagen. They had the conferencing facility, so we moved to Copenhagen and continued the conference in 2014 and came back in 2015 to Dakar. So the only country we have repeated so far is Dakar. So back to Africa, and then COVID hit, and we continued this as a virtual event for 2 years, 2020 and 2021, right? So it has been a continuous event, and from what started off as a workshop with 60 people, today it's about, I think this event probably 400 people have registered. In Kenya it was 450. So we are, in the range of 400 to 450. And over the years, one of the things, I don't have a slide for this, if I want to kind of think about what has evolved over the years, just at a very high level. And those of you who have attended this, happy to chat with you what your perspective is. I would say at least until 7, 8, 9 years ago, all of the discussion in global health supply chain was global health public supply chains. It was distribution supply chains, because most of the drugs are imported, and it was going from central medical store downstream in the public health supply chain. That was dominantly the discussion that was going on, right? And then we started thinking as program committees saying, well, that's fine, but what does the private sector do? There is private sector, vibrant private sector in all of Africa. So we started through the plenary. This is the contributed piece of our program. The way as program committee we think about the contributed piece is, what are some weak signals that we want to amplify and bring it to the larger forum? What are the gaps that are not being addressed that we should be talking about? What conversations are not happening? So that is where the contributed piece comes in as program committee we think about. So we started injecting the private sector conversation into the program here. The other piece is there's a lot of work and a lot of investments goes into technical training, capacity building. What we found missing in that, and things have changed, of course, I'm talking about a historical evolution. What we found missing was there was not much discussion about continuous improvement. As a faculty coming from business school where we train people, continuous improvement is the bedrock of operational excellence. That has to be part and parcel of any work, anywhere it gets done. Doesn't matter it's a warehouse or in transportation, even in big offices everywhere. So we started that using workshops. UPS Foundation used to come. We said, can you host a hands-on workshop about what is continuous improvement, at least to expose people to what this is. And that took hold. And now we can see, for example, you'll see Kaizen Institute. They have a Gates grant, and they have been working with the public health supply chains here, also private sector supply chains, to talk about continuous improvement. So that got embedded in the discussion now in the conversations here. As COVID hit, we are now expanding the supply chain, not just distribution supply chain, but also talking about manufacturing supply chains. So we began to kind of introduce that. The other missing element was all of the discussion dominantly was communicable diseases. And yet, if you look at the disease pattern, it's fast shifting towards NCDs. What is going on in NCDs? What should we be talking about? So we started introducing Dr. Bente Mikkelsen during the COVID time when we had a virtual forum. She came and gave a keynote talk about WHO's NCD strategy. And that we started introducing NCD discussions. And then more lately, I think last year, I know Pragati is here from FIND, started talking about diagnostics. So in some ways, the scope is expanding. We want to really look at the entire healthcare. It's not just public health supply chain. It is much more than that. And that's what we are hoping to bring to you. So we are very open to any ideas you may have. And that's the arc of this event as it has evolved over the years, right? That brings me to the focus here. Here we are focusing on value chain innovation, and that's the talk in many countries, but dominantly in Nigeria as well. We will shortly introduce our keynote speaker on this in terms of what Nigeria is doing around value chain innovation, but that's the focus we have here for this whole event, right? Which includes, if you look at plenary panel sessions, it's again end-to-end. We have a panel on manufacturing, but we also have a panel on supply chain beyond the clinic. So it's not just that the supply chains need to stop at the clinic. How do you get to the community? What's the role of financing coming in here? And then finally, we are beginning to introduce now some discussion, maybe still early, the intersection of climate and health, because we have to confront the climate change and what that means. In terms of attendee representation, so go Nigeria, right? Nigeria has always been the biggest contingent in this event, no matter where we host it, right? Of course, they are much bigger here. Obviously, it's local. So I think by moving to Africa, this is what has allowed us to do that many more people from Africa are able to participate here. Of course, North America, Europe, Middle East, Asia is a smaller segment. The other piece, I didn't show this, sorry. Just pause here. So about 75% of the attendees registered here are from Africa. 60% of the 75% are from Nigeria, right? I asked my students to do a word cloud about all the submissions. So what are some of the themes that are propping up? So you can pick up the usual ones, supply, health, but data and chain are prominently showing up. You can see waste management also showing up prominently here, right? Procurement, suppliers, training. So usual stuff, but some new words are also coming in. This is just a word cloud from the submissions that you had coming in here. Want to introduce briefly the program committee, and I'm going to quickly wrap this up. So while I chair, and there is a long list of the program committee, it's there in your brochure. So we have people from academia across the globe, but we also have people from other agencies, so you can see that. And that's the core program committee. The administrative support from the back end is primarily from my home university, University of Michigan. I know many of you have communicated with Sue Booth. Unfortunately, she can't be here. But then we have 5 student volunteers. I'm sure you'll interact with them as we go through this event. 3 are MBA students, 1 is a PhD student in the School of Public Health, and 1 is a PhD student in the business school. So every year I recruit volunteers to come here. Not only they're helping them pre-conference, but also helping us on the ground here. So without them, we can't run this event. And without support with local, so we said we don't have local partnership. We started developing that local partnership from 2022 with ARC in Senegal, then ARC in Nigeria, ARC in Nairobi, in Kenya, and then finally, we are very, very anxious. How do we go to Nigeria? Without a local partner, we just can't go to Nigeria. It's just too big a country. We need somebody who's going to be a solid, rock-solid support for us. So Azuka serves on the committee, and she stepped up raised her hand saying, I'm going to take that responsibility. So I want to really thank Azuka and her team to be able to come here. So maybe, would you like to come up, Azuka, and maybe welcome before I kind of give a high-level overview of the program. So please give Azuka a big hand. Yeah.
Finally.
Finally.
Yeah. So thank you, everyone. And I think because we've always had this conference in other countries, I don't see our flag. So yes, we must have our Nigerian, yes, because I see, so Nigerian flag has to come in today. Yes, so, but this represents like what Professor Ravi has said, all the places where we have had this conference. And he didn't say it because like I've been in the committee for some years and every time, where are we going to have these? I'll raise my hand. But if you see that list, it has many muscular hands and nobody will see my hand. So I keep saying, Nigeria. Then we go somewhere. So that last time we were planning, I said, no, I'm going to build some muscles. So I've been going to the gym. So when it was time, they said Rwanda. I said, no. I said, Nigeria. My voice was, and then it's here. So finally, we're in Nigeria. So thank you, everyone. So I want to welcome everyone. I want to appreciate, first of all, the government of Nigeria, and particularly the Honorable Coordinating Minister for Health and Social Welfare. He has been very supportive, Professor Muhammad Ali Patey. I want to appreciate him for being at the backbone of this, and he's ably represented by Dr. Abdu Mukhtar. Thank you so much, sir, for being able to come. We all know about how the presidential initiative has been launched, which is for unlocking healthcare value chain. So we are in a pivotal time in our country, and that is why when the theme came up, I said, we must have Dr. Mukhtar here. So thank you so much, the government of Nigeria and all other Federal Ministry of Health representatives. And Nigeria is a country of 36 plus 1 countries. So you cannot have anything in Nigeria, even though it's in Lagos, without having all the other countries here. So I must appreciate all the executive secretaries and heads of agencies from all across Nigeria. For all my ogas and all my madams that are here, you are highly welcome, traveling from far and wide. And for everyone who has been part of this, my team, I always say it, I have the best team in the whole world. So Dr. Stephanie Fowler, and I also have a privilege of having one of our board directors here. I want to appreciate everyone, but primarily everyone that has been supporting us as this committee and everyone that is here from all over the world. And it is a global health supply chain conference indeed. It is a pleasure to have you here, and I thank God for making it possible. And I hope you have a wonderful time and learn, network. Everyone here is a pool of data, and everyone here is a solution. So as you enjoy the sessions, network and learn from each other. Thank you so much, Ravi.
Thank you. I'd like to call out a big thank you to our sponsors at various levels. Without your generous support, this event is not possible. We are a very frugal organization. We also are, our policy simply is, yes, we have registration fees. So in addition to the sponsors, all those people who have paid registration fees, thank you so much, because through the sponsorship and the registration fees who pay, we are able to support those people who cannot pay and attend. So we do the cross-subsidy model. I would say about half of the attendees ask for waiver of registration fees and have the attendees pay. So really appreciate if you're able to pay, and also appreciate all the sponsors here who make it possible to run this event. Without you, we can't do any of this stuff. So again, once again, thank you so much for your support for this event, right? Financially and otherwise. And I also want to call out, this is kind of, I would be remiss if I didn't call out my home university. I know they don't give me a dollar check, but this wouldn't be possible without the infrastructure at the University of Michigan, which is a huge public university. You know, things run quite smoothly, thanks to Sue, but there is a whole back-end process that works of the University of Michigan machinery that makes it possible. It makes it possible for me to tap into the student base and the staff to be able to do all the stuff that we do. The entire COVID 2 days we did this stuff. It was our IT system that did the entire webinar and everything else. So it wouldn't be possible without the implicit support of University of Michigan. So I do want to acknowledge that. Before I get to the main keynote speaker today, just high level. I mean, you have this program. So as I said, we will start with the keynote speaker shortly, and then in the afternoon, then post coffee break, there'll be 2 panel sessions. One panel session will meet here, one panel session will meet in meeting rooms 1 and 2. In afternoon, we go into tracks. Then we have side events, and you can see in your side event in the program, there's one with Village Reach, one with Find and Chai, and one where we will do the site visit debrief. And then, thank you to Logenics. They have been consistent supporter for a party. So we will have a cocktail party at the end of the day today, right? So that's the structure, and the similar structure kind of repeats next day. We start with another plenary speaker, then go into posters, and then panel sessions, and then tracks. That's how it is structured. There'll be 2 side events on day 2 as well. On day 3, we will start with tracks, but then we will come into the main ballroom for a closing event. And the closing event simply is to announce, the prize winners and, take any feedback from you, etc. So we will do that. And then post-lunch, there are 2 tutorials running, one by Kaizen Institute and one by KU Leuven. And this is, I want to emphasize this, as I mentioned, continuous improvement. The other thinking that has to come into global health supply chain is these are complex systems, so how do we bring systems thinking approach to addressing complex problems? And this is where I've been very encouraged by KU Leuven to come forward and bring that event to us. They did that for last year as well. I want to also highlight the research competition presentation in track 18, so that's going to happen on that day. Now, as Azuka mentioned, so on the program you see Dr. Muhammad Ali Pateh was very supportive. He said he would come. Up until last night, I got an email from him at 11 p.m. And he said, unfortunately, I can't make it because of commitments. And but he's very, very supportive. In fact, Dr. Pateh was a keynote speaker on this event in 2020. So he's very familiar with what we do and very supportive, and all throughout. So he's been in exchange, and therefore it's it'd be great if you would have been here. And I was talking to Dr. Mukhtar saying he was planning, but something kept him there in Abuja. So we have want to take this point now to introduce our plenary speaker, Dr. Abdu Mukhtar, and his bio is there. It's a very long bio. Don't worry, I'm not going to say all of those stuff. But as you can see, some of the highlights of what his background is. While he is now with the government, President Tinubu appointed him as the national coordinator of the Presidential Initiative for Unlocking the Healthcare Value Chain. It's called PVAC, and this happened last year in November 2023, right? To invite a lot of investments in Nigerian healthcare system, stimulate local manufacturing, reduce drug costs, implement transformative measures. A lot of the themes that we are going to touch upon in this event. But if you look at his own background, he comes from a very, very varied background across different sectors. He was a director of International Trade and Development Department with the Africa Development Bank, where he looked at the bank's industrialization strategy across multiple sectors. So I'm just sort of only picking up some highlights from your bio. Prior to that, he was a group chief strategy officer with the Dangote Group of Industries from 2014 to 2017, so which means he has significant private sector experience in multiple sectors. He comes obviously with started his career as a medical officer in the Ministry of Health in Kano in 1991. Then he was a management consultant in the United States. He worked for the Bureau of Public Enterprises in the presidency, Abuja, Nigeria, as transaction advisor and special advisor to Director General. He was a group managing director and CEO at Abuja Investments Company Limited, a holding company. So you can see the breadth of his experience that comes with this, which is what we need in thinking about healthcare. Healthcare is, I remember a long time ago, I was giving a talk on telemedicine back in a conference in India, and I apologized to all the physicians in the audience, saying, I'm a doctor, but not the useful kind, like a PhD, right? And the keynote speaker, WHO, said, never apologize, healthcare is too important to just leave it to the doctors, right? So I think that's where we play an important role. This community plays an important role. I'm really delighted that we have in Dr. Mukhtar that breadth of experience, and he's agreed to come and speak. He holds a medicine degree. He has a PhD in pathology. He has an MBA. He has an MPA at Harvard, and then also in corporate governance leadership from INSEAD. So he's touched all of this stuff. So without further ado, I would really like to welcome you, Dr. Mukhtar, to the podium and deliver your keynote address. Yeah.
No, I don't have, yes. Good morning. No, I just simply like to introduce myself as a former doctor. So when people come to me with complaints of headache, I say at your own risk, because it's been a long time since I practiced medicine. But thank you, Professor Ravi Anupindi, the chair of this conference, and members of the program committee, including Madam Azuka, the head of the LOC here in Nigeria, partners, development partners, sponsors, private sector players, and I see key private actors here from Nigeria and other parts of the world, public officials. I want to recognize my colleagues from the Federal Ministry of Health and Social Welfare in Abuja. Ladies and gentlemen, please excuse me if I miss out any particular group. Welcome to Nigeria. In Nigeria, when we say welcome to Nigeria, we also say welcome to Lagos, because these are two different things, you know, those of us know. So Lagos is really one of our most exciting cities. And Azuka, you mentioned we have 36 states. So what I suggest is that the next 36, and each state is like a country. So the next 36 Ravi conferences, supply summit should be in Nigeria, because we have to cover all the states. So we should stay here for the next 36 years to do this conference. But having said that, you know, I'm here first to represent His Honorable Minister of Health, Professor Muhammad Ali Pate. And the only difference is that I'm not wearing the white, flowing, nice dress that he always wears. That is his landmark dress that everybody who knows him wears. So excuse me for that. But I also like to extend his apologies for not being here. He truly wanted to come here, and he's very committed to everything that is going to be discussed here and the theme of this conference. So he's drafted a speech that he was about to deliver. So what I will do is deliver that speech verbatim, as he wrote it, as he wanted it read out. And then I will take a few more minutes to talk about the presidential initiative, if you allow me. So his speech begins, he says, I would like to thank the organizers for inviting me to give a keynote address to the annual Global Health Supply Chain Summit 2024 being held in Lagos, Nigeria. I deeply regret my inability to come there in person, especially when it is being held in my country. My commitments at the ministry have prevented me to travel to Lagos today. On behalf of the country of Nigeria, my government and my ministry, I would like to extend a warm welcome to all attendees who assembled for this important summit to discuss and deliberate on healthcare value chain innovation towards universal health coverage. It is an honor for Nigeria to host the leading thinkers, practitioners, and policymakers in the area of healthcare supply chains. And I understand this summit is the Oscar of supply chain management. This is my second time doing a keynote speech for the Global Health Supply Chain Summit. You mentioned that, Prof. When I addressed this audience last time in 2020, we were in the midst of the COVID-19 global pandemic and figuring out how to get medicines and supplies to countries around the world. We have all learned a lot about the important role of supply chains from the COVID-19 pandemic. Offering quality healthcare to all should be a priority of every nation. This entails ensuring universal and equitable healthcare access to affordable, people-centered, and integrated quality care. Achieving this goal requires strong leadership and good governance, deploying appropriate financial and human resources, partnership with private sector, alignment and collaboration with donor partners, design and deployment of innovative technology solutions. In Nigeria, improving the supply chains for our primary healthcare delivery system remains a key cornerstone of our health sector renewal strategy. First and foremost, we're embarking on a significant upgrade to our health sector value chain and figuring out how can Nigeria be less reliant on imports and build more resilience in its supply chain through health product manufacturing. The Presidential Initiative for Unlocking the Healthcare Value Chain, PVAC, is trying to enhance health product manufacturing, supply chain, and other parts of our healthcare value chain with active participation of local and global private sector players. Dr. Abdu Mukhtar, who heads the PVAC, will be speaking to you, so I will not go into more details here. But we remain committed to ensuring sustainability by bringing the latest but cost-effective manufacturing technology to Nigeria's healthcare system. As we are building a more robust primary healthcare system and equipping health facilities with all the inputs and infrastructure they need for providing high-quality primary care, we are also keen to ensure that the PHCs have medicines and health supplies in stock uninterrupted. One key component of this is related to human resources for health. We want to make sure that in addition to health providers, professionals who are involved in procurement and supply chain management in the health sector are trained with the most up-to-date skills in this area. You all gathered at this conference have a role to play in this regard. Second is new technology for fixing healthcare supply chain problems. We recognize the potential of many technologies. We want to make sure that such technology providers are deeply embedded in Nigeria's overall ecosystem, and local companies and organizations play a strong role in bringing new supply chain technology to our health sector. Beyond getting supplies to PHCs, as we embark on a program to extend essential health services to remote and underserved communities, we also want to make sure that community health workers have the basic supplies they need. I understand that extending supply chains beyond the clinic is one of the discussion points at this conference. We look forward to hearing ideas on how we can further build our programs in this area. Procurement and supply chain are inextricably linked to public financial management. We also encourage all of you to think beyond your silos of logistics and take an expanded view of how finance, in particular public financing inflows, would work smoothly for the healthcare supply chain. I'm delighted to see that the theme of this year's summit is Healthcare Value Chain Innovations for Universal Health Coverage, which aligns with our approach in Nigeria. I'm encouraged to see the summit take an end-to-end and holistic approach to supply chains by exploring these issues through panel discussions, presentations, and posters. I'm delighted to see that a diverse set of stakeholders have assembled to have these discussions for next 3 days. I hope that you will come up with some concrete ideas on how to move forward along many of these important topics. I look forward to receiving summary highlights of your conversations. I appreciate the commitment of the organizers of GHSCS to continue to host this summit in the African continent. Thank you very much. To ensure inclusivity and meaningful discussions on relevant issues facing African countries and more broadly, low and middle income countries, including featuring prize competition to showcase excellence in supply chain implementations in LMICs and supporting research on supply chain innovations. I wish you the very best of deliberations and discussions. I hope you get a chance to visit some healthcare clinics, meet with your counterparts at different levels in the supply chain, and build more collaborative partnerships, both here and everywhere globally. Again, welcome to Nigeria and welcome to Lagos. Thank you. So that's the minister speaking, and now I will switch to, I don't know how many minutes I have, just to talk about the presidential initiative for unlocking the healthcare value chain, which the minister mentioned. And I'm not reading a speech. I think it's always easier for me. So this initiative was established in October of last year by His Excellency President Bola Ahmed Tinubu to address specific challenges that we face in the health sector. As you know, as in most African countries, Nigeria is heavily import dependent when it comes to healthcare products. We import between almost 80% of our healthcare products. When you break it down into different kind of product lines, for therapeutics, almost 70% of therapeutics are imported. Almost 99% of our medical devices, including test kits, are imported. Almost 100% of the vaccines here in Nigeria are imported. We used to produce yellow fever vaccines in the 70s, but we don't produce any anymore. And so in response to that, the presidential initiative was tasked with 3 key KPIs, we call them, when the president established. The first one is really to reduce that share of imported products for healthcare manufacturing. And this problem is really the same in many African countries. You know, when I was at the African Development Bank, one of the things that we did was to develop a strategy for pharmaceutical industry, and this is what we see across the continent. The second KPI for this is also to reduce medical tourism in Nigeria. And in this country, we spend on average about $2 billion every year on outbound medical tourism to different countries. So we aim to do this by providing quality infrastructure for hospitals, clinics, also diagnostic facilities, making sure that there is the right human capital to be able to undertake those. The third KPI, which is cross-cutting, is really just to create jobs along the various parts of the value chain, while also attracting FDI and mobilizing local resources. Now, people say to me, why is this different? And I see some of the industry players looking at me saying, Dr. Stella, I see you laughing, thinking we've done this, we've been there, we've had that before. But there are a number of reasons why we think this is different this time. The first reason is that this is not being done in isolation. It's being done within the context of an agenda, a broad agenda, a healthcare agenda for Nigeria. This agenda, whose objective is to save lives, reduce physical and financial pain for Nigerians, and to make healthcare universally available to all Nigerians, is anchored on 4 pillars. The first pillar, and you might have heard the minister talk about this, and I'm not going to dwell on this. The first pillar is really just a whole issue around governance. So the governance in the health sector. In Nigeria, we have the federal government, we have state governments, we have the private sector where most of the spending is done. We have so many donor partners, and many of them are here that are trying to support and to assist. We have the private sector, the public sector. So under this governance pillar, what we are trying to do is to have one conversation in the health sector, one plan, one budget, one pot of money. So there is transparency, there is accountability, everybody is around the table. We launched under this a program called the sector-wide approach, where just basically everything is transparent, everybody knows what everybody else is doing. We identify the priorities as a country. We work with the donor partners, with everybody else, and everything is transparent. So that is the first pillar. The second pillar is improving population health outcomes. And this is where all the discussions around primary healthcare provision, access through enabling a national health insurance system, which is being transformed very heavily under this administration, targeting specific disease areas, to target, linkage with other sectors, wash, water, sanitation, environment, and all of those. That is where that conversation lies. The third pillar of the health strategy is unlocking the healthcare value chain, which is what I'm talking about. And then the last pillar is health security. Basically, how do we prepare this country for pandemics? This is where we try to build things around resilient supply chain mechanisms. This is where we look at the impact of climate change and how it impacts everything that we are trying to do. Across all these 4 pillars, we have cross-cutting pillars, human capital for the sector. How do you ensure that you have the right human resources for this? How do you ensure that you have the right data, digital technologies to enable this? How do you mobilize the financing resources? These are all cross-cutting pillars. So the unlocking healthcare value chain that we're doing in Nigeria is not really just an isolated, let's just empower manufacturing, but it's just an integrated system. So that's one reason why I think this is different. Second is that it's also we're trying to build an ecosystem. One of the first things that we did when we started this is to engage with the manufacturers. We created a group called the Pharmaceutical Consultative Forum, and Dr. Stella, many of you and your colleagues are members of that forum, to basically listen to the industry and say, what are the key issues that you're facing? And often people will say, oh, we need money, but when you listen to the industry, they say the regulations, the policies, those are the kind of things that make these things difficult, the infrastructure. So it's not really just the financing part of it, but it's also just this whole discussion around building an ecosystem, the research and development base, the supply chain mechanism, the market access, the shaping the market. How do you create that market to incentivize manufacturers? So based on that feedback that we got from the industry, we developed an ecosystem approach, and I think that this is really important in what we're trying to do. And so the way also this is structured is, and I don't want to bore you too much about this, is we report to the president, but we also have multiple agencies of government. So every agency that needs to play a role in ensuring that this agenda is carried forward is part of this. We have 5 ministers actually involved, so the Minister of Health, Minister of Industry and Trade, Minister of Finance, Minister of Budget and Planning, and the Minister of ICT. We have the regulators, NAFDAC, Pharmaceutical Council of Nigeria. We have the financial institutions in Nigeria, Bank of Industry, the Sovereign Investment Authority. We have the representatives of the private sector. We have customs. We have the tax revenue agency. So everybody who has to make any decision or has to agree on anything is actually part of that initiative. And the president has delegated his power to the Minister of Health. So when we see the Minister of Health, we actually see the president on this. And so things are really aligned between what the federal government is doing, what the Ministry of Health is doing, and what the rest of government is also doing. So this is really why we think this is different this time in Nigeria about what we're trying to do. I talk about some of the challenges in local manufacturing in general. Infrastructure is key. Power supply, obviously, is a big challenge in Nigeria. The roads, the transport infrastructure, which really ties closely to supply chain management and logistics. Talk about access to finance, access to markets, and human capital. So we approach this basically in a couple of ways. The first way is to find ways to address all of these policy challenges and regulatory issues. And then the second one is, of course, talking directly to the manufacturers and building their base, providing the financial systems and capabilities that they need. In terms of the policies, one of the most important things that has happened is getting the president to sign an executive order, which he did end of June of this year. This is an executive order targeted at ensuring local manufacturing of healthcare products, building robust supply chain mechanisms, and also just enabling the sector overall. The key elements of this executive order are: 1, zero VAT, zero duty for importing equipment, machinery, and raw materials for the production of local healthcare products. This is a big game changer. To be honest, when I started this job, I thought this is the kind of thing that I would be thinking of doing or achieving like 2-3 years from now. But thank God, and thanks to the leadership of His Excellency Mr. President, we're able to get that done. It's signed, effective immediately. We finalized developing what we call a framework, working with all the relevant agencies that need to be, again, have anything to do with any of this. The reason why this is important is, and I see my good friend from Global Fund, Madam Hui Yang, is, when you talk to some of these global buyers of some of these products, it's good to produce locally. But, you also don't want to produce products that are more expensive that people cannot afford, or when you insist on buying those products, then you'll not be able to supply to as many people as you want to reach. So countries should think about how can we produce, competitively, how do we get in that band? So the analytical work that we did gave us we have a detailed breakdown for the cost of production for each of these products. What is a component for power, what is a component for tax, what is a component for whatever, supply chain, logistics, and everything, and then seeing where we can have the biggest impact. Just implementing this part of the executive order, which is zeroing the tax and VAT for raw materials and machinery, will bring down the cost of production by about 10 to 12%. And this is based on unit production cost numbers. And so just doing that will actually hugely impact that. The second provision in this executive order, which I think is relevant to the discussion today, is a provision for market shaping. We have also included in the order a mandate by the President to create mechanisms to shape the market by guaranteeing volumes, aggregating volumes, doing framework contracts, and so on and so forth. So those are key elements in the order, and within that, we are in the process of creating a platform that will really disrupt and change the way procurement systems operate in the health sector. The President has given an approval for that. We are working to design that, and I think that by Q1 of next year, Nigeria will have that platform that will be the main driver for this part of the policy. So that's what we're doing in that. Of course, there are also other incentives that we are providing, thank you, for just the health sector in general, but also that translate into the whole idea about investing, attracting investment. So that's on the policy side. Ecosystem. So we're also looking at research and development, and I will stop soon. Ravi, I see you looking at me, so I will stop very soon. We're looking at value chains, so you also have to start from the R&D perspective, when you're looking at the very basic. R&D spend in this sector globally, in Africa, I think about 2% of the global R&D spend is in Africa for pharmaceutical manufacturing and those kind of products. So we need to improve that. So one of the first things that we did is to see what kind of R&D partnerships can we create with a company called Universals in Belgium. We signed an MOU to establish a platform for mRNA vaccine production because, again, we think that the future for vaccines is mRNA, and even though we know it's complex to start thinking of producing vaccines, mRNA vaccines right now, but I think that the most fundamental, creating the platform for that mRNA production is important. Making sure that we have the trained personnel to be able to operate within that kind of system and machinery, I think is important. So we've already done that. We've developed a business case for developing a clinical trial ecosystem that will establish about 435 clinical trial centers. And again, I'll be back in Lagos next week because there's going to be a big clinical trial conference where we will unveil the plan for government. But this is a very ambitious plan that will call for an investment of about $770 million US. But that will also generate about $3.8 billion revenues for the countries. So for every $1 that you invest in that, you'll actually generate $5. We've identified partners for that. We've mapped the existing infrastructure, including talent for clinical trials. We've actually sourced funding, and we're embarking on 2 clinical trials next week for pilots in 2 centers in Nigeria for 2 drugs that are already been developed. Again, with ecosystem development, we also have important partnerships. USP, United States Pharmacopoeia, which is an organization that actually helps companies establish the critical human capital that they need, but also move them along the whole WHO pre-qualification process through technology, through just enabling building talent, building capacity, and all the things that they need to do. So we are doing that. We've secured funding from a couple of donors to establish that, and we're identifying the local players with whom we work. So there are a lot of things happening. We're working with NAFDAC, the regulator, to upgrade. NAFDAC is one of the few MLA level 3 in Africa. I think there are about 4 or so of them, and NAFDAC is number 3. We are already on the path to moving NAFDAC to level 4. In that, building the capacity, using technology, human capital development to make sure that that whole regulatory system is done. I've talked about the ecosystem, the policy things that we've done. I'll close by just talking about the financial side of things. Again, many of the things, finance is important. So when I said, these other things are really what we hear, but finance is important, especially, you need also access when you do this kind to long-term financing at concessionary rates. So we've been busy mobilizing funding. We have, with Afrexim Bank, signed an agreement of $1 billion for the healthcare sector in Nigeria. With the European Investment Bank, we have also been discussing, how we can use a facility that they call the Human Development Accelerator. We've actually, a few days ago, we discussed 4 projects which are very, very interesting to the EIB that they are planning to invest in Nigeria, African Development Bank, Bank of Industry. So we are mobilizing this pool of funds. The commitment that we are making to Nigerians is if you have a project or an idea, a project that is really bankable, that is feasible, the money should not be a problem. You should worry about other things, but you should not worry about money. So we're trying to design multiple instruments, debt, equity, guarantees, TA, facilities, multiple tenors, so that whatever you need, depending on your size, you should be able to say, you can tap into this particular pool of money. And we're really working to implement that. We've been successful in this mobilization journey so far. We've been talking to a number of companies. We've seen a lot of interest, companies coming in our pipeline. Currently, we have about 56 companies. These are not just ideas. These are really good projects that we have vetted that are actually almost bankable. Some of them really are already discussing term sheets with banks. About 35 of these companies are local Nigerian companies. About 21 of them are international. Total value for this project is about $3.1 billion. And I can give you some examples here. Some I can mention names, some I won't be able to mention names. One good example is Vestagard. So Nigeria has 25% of the global burden for malaria, but we do not produce, and malaria, the bed nets, the long-lasting insecticide-treated nets is still seen by the experts as one of the best ways to prevent malaria transmission, but we don't produce a single bed net in Nigeria. So Vestagard, being the world's largest producer of these bed nets, we had a discussion with them. We signed an agreement at the UN General Assembly a few weeks ago in New York. And they're coming to Nigeria. They have mobilized their resources with one of the biggest DFIs in the US. They are talking to multiple players, but more importantly, they've identified a local partner to work with in Nigeria. The plan is to produce 10 million bed nets every year for Nigeria and for the broader West Africa region. The business plan is already done. Site is actually available. The factory is almost ready. I was in Ogun State 2 weeks ago, actually, just to inspect that. So that is happening. This is public information. This is one concrete example, and I think that maybe some of your discussions around supply chain management, you should also think about that, because I think the way to look at this is also in Nigeria, our ambitions are not necessarily for Nigeria, but we also need to see how we interconnect. Supply chains cannot be siloed. Those of you who work in this, that there are multiple touch points. And so for many of most of the analytical work that we did, actually looking at the value pools, whether it's vaccines or therapeutics or commodities or test kits, we've looked at multiple levels of ambition. So the first level of ambition is always to say, what is the difference between the demand and the supply in the Nigerian market, and how much products or what volume do we need to produce to fill in that gap? The second level of ambition is to say, if we stop importing into the country and we produce whatever the entire demand is, and we know for each of these products what the demand is, because we spend a lot of time really doing analytical work at the beginning of this process. So what will that volume translate into? How many manufacturing plants? What is the CapEx requirement for this? Who are the key players? Where are they? How can they interconnect? How can we integrate the supply chains across multiple countries? And then there's a third level of ambition, which is really to say we produce all what Nigeria needs, the demand here, but also produce for the wider Africa region. Nigeria is 230 million people. West Africa is 460 million people. So right there you have the wider market, but you can also continue to have bigger levels of ambition, which is to say, how do we even connect beyond West Africa? Africa, we have the Africa Continental Free Trade Area. The African Medicines Agency is being implemented, and Nigeria is going to sign very, very soon. We just finished the paperwork to do that. So in the next few weeks, Nigeria will join formally the AMA. And so with all of this, you can have all these levels of ambitions. I was at EMZO a few weeks ago, Madam, and I said to you, what I would like is to see EMZO products being sold in pharmaceutical shops in the US, in Europe, everywhere. And that, for me, is one of the things that I want to do with you. So we're doing all of these things. Coming back to supply chain, again, we signed an agreement with Zipline. And Zipline is when you talk about distribution and logistics, the world's largest drone company based in California. They're already working in 3 states in Nigeria, in Kaduna, in Bayelsa, and Cross River states. We just signed an agreement with Zipline to actually roll out that program nationwide, to build, hubs. So we're not going to be in all the 36 states, but in each region, we've again mapped based on set criteria where we'll establish the basic infrastructure for Zipline, where they will be primarily citing that infrastructure by distributing products, blood products, medicines, vaccines to underserved and hard-to-reach areas. And there are many of those areas in Nigeria. So really just transforming and using technology, using drone technology to really transform that entire supply chain mechanism. So that's one of the things that we've done. I will stop here, but again, in our goal is by 2030, we reduce those numbers to be able to produce about 70% of our local products that we use, at least essential parts of the products, to have at least 2 vaccine plants. And we already have multiple projects that we are incubating, and that are actually different paths. Some of them already have their site. Some of them have already acquired their technology. They have technology partners for specific products and diseases. And so that's one. We intend to also by 2030 to have at least 5 companies producing rapid diagnostic tests. That's one area where we see a lot of activity, the usual suspects, malaria, HIV, other STIs, pregnancy, diabetes, those kind of things, so we want to do that. On the API front, most of the manufacturers here are doing fill and finish, importing the API, but we know that, some of them in this room have this grand ambition to produce APIs, which is really where our analytical work shows that that's where the greatest value is. So our plan is at least 20% of the APIs at minimum, and I think that we can do more given the interest that we see from the industry. So I will stop here by saying, look, we're delighted and we are moving ahead in Nigeria as a country to implement many of these things. We feel that there is a lot that we can learn from other African countries, from the global partners to do this. We cannot do this alone. We need partnerships, strategic partnerships with global players on all fronts, whether in academia or private sector. This morning I had a discussion around, how do you build the human capacity to even, empower some of these facilities. You need skilled training. How do you create that finishing school or torches that you can do to this industry? So we're having all these strategic partnerships and discussions that will enable the sector. And again, it's an ecosystem approach. We feel that doing this will create value not only for Nigeria, but for Africa and for the rest of the world. And really, all of you in this room are here for one reason only, to make sure that healthcare products are available to the people who need them when they need them, but also in an efficient way that everybody can afford. So thank you, and yeah, that's all I will say.
Thank you so much, Dr. Mukhtar. I think we'll probably at least entertain a couple of questions from the floor for Dr. Mukhtar. He's graciously agreed to stay on.
My name is Patrick Lukule. Thank you very much, Dr. Mukhtar, for those great initiatives that the government of Nigeria has embarked on. I particularly like the one you mentioned about reducing the burden on manufacturers and bringing machinery into countries. This has been a major barrier to manufacturing locally in countries. But since you signed the MOU or since this initiative was unveiled, companies are still struggling to bring in machinery. So when is this really going to be practicalized? What is blocking the implementation of these very important initiatives? And then lastly, of all the MOUs that you have signed, is there someone monitoring the implementations in these MOUs? I mean, there's a whole list of MOUs around the continent, and often after a few years, you almost forget what MOUs have been signed. Can someone be monitoring this to make sure that they are actually having impact on the continent? Thank you.
Should I answer one at a time? Or? Okay.
Thank you. Dr. Mukhtar, thank you very much for your comments. Fantastic plan laid out. It's a very simple question. How would you prioritize? What have been your priorities, let's say, for the next few months? It's been about a year since the PVAC was founded. What are your priorities going forward in these areas? What would you like to see achieved? Thank you.
One other question behind Professor Anato.
Yeah. Thank you very much. My name is Professor Enato from University of Benin, Nigeria. Thank you for the presentation, a very huge task. I'm just wondering, HEAD is on concurrent legislative lists, which means the state government also have have something to do. I don't know how you're carrying the 36 state governments along in this very laudable initiative. The other question is, you mentioned about capacity building, and when we talk about supply chain, one of the areas that we really need to strengthen is capacity building. I would like to know what you have in place, and I would also like to discuss with you personally on that, on how that can be strengthened, because in the past we've made efforts, we've tried to do that through the Ministry of Health, but I think we can also strengthen that through our academic institutions. Thank you.
Okay, so thank you for those questions. I'll try to be brief. Patrick, you're absolutely right. We talk to the industry every day. The order was signed, and the president signed and said it's effective immediately. The reason why this is not being done yet, or companies are already also still suffering, is because we then need to work out the framework. We want a system that once it starts, kicks off, then there is no issue at all. So one of the first things that happened, and I'm being very frank here, is also finalizing the list of products that will be exempted from all of this. And this is a discussion that involves, talking to the industry. When we talk to the industry, we say, look, what are the key components that you need, the raw materials and the machinery? I got at least 27 pages of list. And I went to customs, and customs said, come on, if we exempt all of this, that means we'll not be generating any revenues. And the tax agency said the same thing. So what we're trying to do is really putting everybody in the room, and we've been having that discussions like every single day in the last few weeks to say what makes sense, what are the key things, so that once it's signed off and agreed upon, nobody is going to have any issues. So this is where we are. We've been on a selective basis, helping companies who have that particular challenges. just because we know that that is coming. But this is, I would say that in the next 2 weeks, and we're going to gazette that entire list once it's fully agreed. So it's really just to agree between the industry and the customs. We don't want any back and forth. So once this is agreed upon, we want everything to point. So that's good. MOUs, yes. I want you to monitor us. So you say, who is monitoring us? I want you to keep track and come to us and say what is happening to this MOU. But besides that, there are mechanisms in government that track this. When we sign MOUs, we don't sign MOUs and just say this is an MOU. When we sign, the day we sign an MOU, we actually set up a working group or a team to actually implement that project. So in PVAC, for any MOU that we sign an agreement with Zipline. We already have people on my team from day one, with people in Zipline, with people in the Ministry of Health that are working with the different state governors that are relevant, that are already working, and those, we are monitoring the progress of that. If we don't achieve, then there is a problem. So that's being monitored. And of course, at the level of the presidency, there is also a delivery unit that monitors like all projects, and everything that we do, we inform the president, and this, records are kept, and people will come to us every few months, and we have to give a record. But the most important checking mechanism, honestly, is Nigerians, is the industry. You should come to us and say, Abdu, you said this in Lagos, you're going to do this, why haven't you done it? So I'm calling all citizens to also do that. Paul, priorities. Look, there are many. But if I just have to say, of the just quickly, implementing this executive order that Patrick is talking about, making sure that it's actually working, that the industry is happy that this is happening. I think this is a big game changer. That's number one priority. Number two, I think I said we have a pipeline of 56 projects. We need to be able to take these projects to bankability. We need to be able to say there are 2 companies that are already manufacturing or building manufacturing plants to establish as a RDTs or an API plant, or we say Madam's API plant is up and running because we're able to give her all the resources and the policy support that she needs. So really just moving some of those projects to say these projects are actual projects that have been implemented and are happening. Other important enablers, human capacity, at least even having like a solid plan to be able to build the capacity, all the things that need to be done in parallel. I think that launching them and making sure that those are happening as we move on, I think those are also priorities. Concurrent list, excellent question, Prof. Yes, but when I talk about what we're doing in the health sector, I talk about the SWAP, the sector-wide approach. When I'm talking about governance, so what that does is also just bring in, when I say one plan, one budget, one resources, everything. So that one also includes the state. We have constant dialogue with the state. They are part of this, so they are part of the sector-wide approach. We meet with them very frequently. In fact, next week, we're going to be in Maiduguri. The minister, myself, and all the key players in the health sector in Nigeria, including all the 36 commissioners of health. This is called the National Council on Health, which is the highest decision-making body in Nigeria, where all the commissioners are there. And I'm talking in what I do to many commissioners. When you talk about even establishing factories, you need land to do that. The Nigerian laws vest land ownership in the state governors. So talking to the governors, and every day I see commissioners of health. Last week I had 3-4 commissioners of health in my office, talking about specific projects, what we need to do. So we are all aligned, and that's the whole idea about bringing everybody together in the SWAP program. Capacity building, absolutely. I'll be happy to talk to you offline, but this is an area that is really critical for the entire health sector, but also very importantly for the manufacturing sector. You need to bring everybody, academia, global players, but the industry itself, to make sure that whatever human capital you are developing is actually what they need. Paul here from Empower School of Public Health is telling me that medical knowledge, whatever gets doubled, I think every 90 days or something, 78 days. It used to be every few years, new knowledge, appears, but now it's just a matter of months. So you need to have that constant flow of training and human capital development. And we'll be happy to work with all partners here to make sure that happens. Yeah. So, any more? Thank you. That's it.